The Michael Berry Show.
My entire childhood was marked with horrible, horrible allergies growing up in Orange. And many of you, I can only speak to Southeast Texas, but many of you who grew up in this region experienced the same thing. I had tubes, not once, but twice in my ear, which is basically a culvert to get some drainage out of there. And I had a terrible procedure they no longer do called windows done. There was a brief period of time around 79 or 80 where they would go in and literally punch holes in your cheekbones and try to create a culvert there. The idea being, you're kind of releasing the dam and letting the snot out of there. It was extremely painful recovery, and it didn't work. And to this day, when I have anytime scans are done on my face, the doctors will go, "Oh, you had windows, huh?" Yes, I did. Oh, yeah. And they don't want to tell me, but then I tell them I know. It was a terrible procedure. So my entire childhood is marked by these terrible, terrible allergies, stopped up, your eyes running. It's pollen season right now. Those of you who know, and a lot of us do. Well, I meet my wife when I'm 18. She's 21. She's just come from India, and she has no allergies. And she can't understand why I'm constantly talking about allergies and blowing my nose and everything else that goes with this disgusting condition. And she has no allergies, and I'm jealous. Well, lo and behold, over the years, she does develop some allergies. And unlike me, she does something about it. So 5 years ago, she discovered this doctor named Chris Collaco, and he came highly recommended. And he's a superstar allergy doctor, asthma doctor. So she goes to see him. And, she does all the tests. Everybody's had those tests done, but you probably had them like me when you were a kid, and they're much better today. And she comes home and tells me, she's allergic to dust mites, which are in a lot of beds. So we travel with our own sheets now, and she's going to start taking these shots. And so she takes those shots, and it took about 6 months for her to be completely allergy free. And it was one of those, before and after testimonials that you don't really believe. You figure the person had to be compensated. But I'm here to tell you it was true. So she started in on me. This was 5 years ago. So within within a year, she just goes for, I think, a monthly, and she's the happiest person in the world, and you need to go. And I'm a guy. Guys, y'all understand. We'd rather bitch about it than do anything about it. So eventually, it got so bad, and y'all have had to hear me go through this, that in late October, early November, I caught an upper respiratory, which I do about every 3 years, or so I thought, and it was unbearable. So about a month ago, I guess, go to her doctor, and I am already on a path to improvement. And he identified a number of things for me that I had no idea, and I'm just impressed because I like people. My urologist, Mohit Kara. He geeks out on urological stuff. My cardiologist, Stan Dukeman, he geeks out on doctor stuff. I like people who are passionate about what they do, the way Russell Ibarra is about the functioning of his kitchen or the hiring of people. So the more I talked to this guy, I was really fascinated by his passion for this issue that affects a lot of people. And his clinic is called Advanced Allergy and Asthma Center. It's at the corner of Stella Link. Stella Link and Wesleyan are basically the same street, and Holcomb and Bel Air are basically the same street. They just changed names. So Wesleyan and Holcomb, or Stella Link and Bel Air, or wherever you want to think about it, that's where they are. Anyway, so we get to talking about these allergies and what causes them and all this stuff. And I thought, I'm 54, relatively well-read. I ask a lot of questions, and I learned things from him in just a few meetings that I had no idea about. And I said, well, let's share that on the air, Ramon. So I'm going to need you to pay attention, okay? There'll be a quiz at the end. Dr. Chris Collaco is his name, Collaco. Don't try to make sense of it. It's a Portuguese name, is our guest. Let's start with this, Dr. Chris Collaco. Article in the Chronicle a few days ago that said it is pollen season and it's a bad season. What does that mean for people? Why does that cause us so many problems when it's pollen season? Explain it to me like I'm 6 years old.
Hi, Michael. Thank you for having me on the show. And we'll start at the beginning. And so an allergy is an abnormal response to something that's not really harmful to you. And so the body, depending on your genetics or your environment, decides that it's going to mount this immune response to something. And then every time you get exposed to that, the body decides, hey, this thing is affecting me, and I'm going to fight it. And so that's what begets allergy. And so pollen, is ubiquitous, and Houston has the right amount of humidity and high levels of pollen that, most people tend to have some level of rhinitis or runny nose and ocular symptoms. That means drainage from your eyes and those kind of things when pollen is very high. And so that's your introduction to having allergy. Now, most of us, have a certain level of resilience in that you have those symptoms, and sometimes it's for a day or two, and then you slowly get better. But what happens with allergy is that it's considered an atopic march. And so if you start off with one or two things, and, we'll just make up a random amount, you make 100 histamine molecules. And histamine is the chemical that your body secretes that causes you to have the itching and the sneezing and the eye itching and the drainage and postnasal drip and all that kind of stuff. And, the first year you may make 100 histamine molecules, and, you can take an antihistamine and you do better. And then, with the natural course of the disease, what happens the following year is you make even more and you become allergic to more things. And so once you get on that pathway of this abnormal immune response to something that's harmless, the body just, goes down that pathway and starts reacting to different pollens, to dust, to animal dander, to foods. And that's how allergy is. And so most people within the next week or two, and those who know, you're going to get miserable. Because once you start seeing, I've just noticed the leaves are already falling. Once that starts, the oak pollen is going to start. And so everyone in Houston knows when you start seeing a little bit of that yellow stuff on your car, you're going to get kind of miserable. And so that's what's coming. And so as, over the years, what you see, and most people may, have some idea with this, is that the symptoms initially start to, and they're not so bad, and then the following year it gets worse and gets worse. And then finally you get to where you're using multiple different medicines and this, and you're still miserable. And so what rhinitis does is you have all these secretions in your nose, and they have to go somewhere. And so, like, what Michael was saying, in his case, in the old days, they thought, hey, we'll just cut out this path, and that will help everything drain, and then you'll be better.
Dr. Chris Collaco, hold right there. Our guest is Dr. Chris Collaco. He's an allergy and asthma specialist. He's now my doctor. He's been my wife's doctor, and a very good one. We'll continue our conversation with him right in the middle of pollen season. Coming up.
Mr. Michael Berry.
Hey! Dr. Chris Collaco, let me take you back for a moment. You said that when this pollen comes out, even if we take an antihistamine, which dulls down our natural reaction, but you talked about the symptoms of what happens, the result, and that's the snot, that's the eyes watering. Why is the body doing that?
So so through evolution, allergy initially, and I know there's caveats to this, and the immune system, the part that's responsible for allergy, they used to be directed towards parasites. And so that part of the immune system used to be very active against parasites and those kind of pathogens. In most of the developed world, we don't have that much parasites to deal with. And so a simple way to think about it is this through evolution, this part of the immune system that was functioning so well to take care of parasites now sort of has nothing to react to. And so it starts going down this pathway to find something to do, if you will. And that's a simplistic way of looking at it. But now it starts reacting to allergens. And so once it gets on that path, it sort of thinks that it's protecting you against this stuff when this stuff is not really harming you.
I don't understand the purpose of the mucus. How is it forming all this snot? How is that ever going to help me?
Well, if when you have a lot of that snot and it's draining out and that kind of thing, it's you probably not, when you're very congested and you can't breathe, you probably won't get much pollen in there. And so, like I
didn't
said,
even think of that.
it's not even a good response, but it's just the way the body is reacting to it.
Well, no, but that makes actual
And
sense because that would reduce the amount of pollen that you would continue to get. It never crossed my mind. So what we're
right, and
doing
so
now.
sometimes, go ahead.
Go ahead.
No, so sometimes when people say, "Oh, I had sinus surgery," and now they trim my turbinates and open me up, and now I can get all this stuff in there, and I feel like it's still making me miserable. And that's where it's all open now, and so it doesn't change. The surgery is not going to change your immune system.
So what is the
And if the
answer?
immune
You got to
system
get
is
your immune
reacting,
system to stop reacting in this manner?
correct. And
Okay.
so one of the things that allergists do, or that your wife did, right? And we're jumping the gun here. So we're saying, oh, I'm not saying that everyone needs shots or something like that. But if you look at that, what allergy shots, and they've been around for 100 years, and what allergy shots is to try and teach the immune system, if you will, to not react to what you're allergic to. And so what we do is you make these extracts, which are basically has exactly what you're allergic to, and you give it back to the patient. Now, you couldn't possibly give them the full strength shot, or you'd kill them because they'd have a full body allergic reaction to the shot. And so what you do is you dilute it down 100,000 fold, and you give it back to the patient in slow incremental doses. And so in that way, you're slowly introducing the allergen to the body. And what that does over a period of time is it starts generating these cells in the body called T suppressor cells. And these T suppressor cells suppress the immune response to whatever's in the allergy, to whatever's in the shot. And so that is why in patients who've done immunotherapy and those kind of things, they don't react as strongly. So when your body sees the pollen, the next pollen season, and you've been on shots, it doesn't react as strongly to the shot, to the pollen. And so, medications treat symptoms. They don't do anything for the problem. So the problem sort of festers along in the background. And that's why, when we talked about me and you, I was like, hey, during pollen season, and I do this too. If I go run around rice, I mean, this is, I try not to do the loop during oak season, but if I do run around it, I'll sometimes have, mild symptoms. I'll immediately do a sinus rinse and clean out all that pollen so it's not sitting in my airway, in my nasal passage, making me horrible.
Mm-hmm.
And that way you just physically do better. But what allergy shots is to try and tell the body, hey, stop reacting to this, and so it's trying to put a halt on your body going down this wrong pathway of reacting to something that's harmless.
Mary Talley Bowden has become nationally famous for the fact that she criticized the COVID protocols and all those. But before she was famous, and just as that was beginning to happen, I had her on the show to talk about a sinus rinse because I had seen her. She had a handle like Dr. Snotsucker or something funny like that. And she would post videos of doing these sinus rinses. And she was a big fan of them. My wife does it. I don't do it as often. I know I should. I'm just irregular. My wife does it frequently. But on that point, I know Mary Talley Bowden is a huge fan of that, and it sounds like you are as well.
I am. And so, the all of the sinus rinses come from this. So in yoga, 100 years ago, so in India, they know there's a thing called neti, and actually the neti part comes from neti, which is a term in yoga of where you rinse out the nasal passages. And they knew a long time ago that for whatever reason, if there was inflammation in the nose, the chest would do bad. And so in patients who have asthma, and this is, a long time ago in India, they rinsed the nose out, and no one really knew why. Over the last 15 to 20 years, we've started to find out that it's considered the single airway hypothesis. And so if there's inflammation in one part of the airway, that inflammation will irritate the whole airway. And so the nose is connected, to the lungs. And so a lot of people will experience this when they have sometimes bad sinus infections and upper respiratory infections. Then they'll have wheezing and those kind of things. And that's where, physically cleaning out all that mucus helps. And the other thing that, these rinses do is physically clean out the pollen or the dust mite or whatever. So the antigen is not just sitting in there, keeping the immune reaction going.
Hold with me for just a moment. Dr. Chris Collaco, he's at Advanced Allergy and Asthma Center, which is Wesleyan and Holcomb. We've had great. He needs out. You hear him sneeze? He needs. He is our guest. He's done great for my wife. I've started with him, and I really like his ability to explain these things, and we will continue having him do that in the middle of pollen season. Coming
Hell yes, we're going to take your AR-15. B-E-T-O Beto.
The Michael Berry Show.
Hell yes.
Chris Collaco is our guest. Advanced Allergy and Asthma Center. If you can't remember his name or the location, you can email me. He is not a show sponsor yet. He doesn't know he's going to be, but he's not a show sponsor yet. But I will still forward you, or Emily will forward you, to their phone number so that you can call and get an appointment if you want to go have the test done or you want to go see him for a consultation, so that you can connect with him. I'm a big fan because he's made my wife very healthy and very happy, and that makes me very happy. So, Dr. Collaco, let's go back to you first put my wife on Zyrtec, and we hear a lot about Zyrtec. Now it's over the counter, and Zyrtec basically suppresses the body's desire to overreact to this pollen we see out there all the time now. Can you talk through the history of that drug and how that has affected your practice?
Zyrtec is an antihistamine. And so initially, when Zyrtec first came out, it was prescription. And so, you couldn't get Zyrtec unless you went to the doctor or you went to the allergist. And so, there's a couple things that moving the medicine over the counter has done to the practice of allergy for us. And it's just interesting to see. And so when you have a lot of histamine around and you feel miserable and you have drainage and congestion and you're itching and all that kind of stuff, and you would have to go to the doctor, and a lot of times the allergist would say, hey, let's see what you're allergic to. And they do testing and, find one or two things that was positive. And then sometimes, either start you on treatment for that or do avoidance measures or those kind of things. But as these drugs have gone, over the counter, initially we were thought, oh, there's going to be no need for allergists. But in fact, what we've seen is that we now tend to pick up patients who are a lot more serious. So if there was no Zyrtec, when you first start having allergy, and let's say you're just allergic to dust mites, and I'll just use that as an example, then we would see the patient, and sometimes if they'd get on shots for dust mite, then they'd do a lot better. But now with Zyrtec being over the counter, so let's say you have a mild dust mite allergy, and then you start having springtime season, then you take Zyrtec. Zyrtec blocks histamine, but it's not doing anything or not doing much because the allergy process of, developing allergy to stuff is still going on. And so what happens is then as long as that Zyrtec can keep blocking the amount of histamine being released, you'll be okay. And then you start doing a nose spray for allergy, and that's over the counter. And in the background, you're developing, not in all cases, but in a lot of cases, you're developing more allergy. And so then what happens is the person, it's almost rare, almost never that I see a patient who's not tried Zyrtec before or tried nose sprays now or those kind of things. And so while the Zyrtec is helping you, do okay or control your symptoms, if the allergy is going on in the background, then you're developing, more allergy. And so it's not atypical for me to see a patient who has now multiple things that they're allergic to. So, as in Michael's case, and since, we're talking about this, it can be multiple trees and grasses and those kinds of things. And so what we tend to do, as allergists, see patients who are a lot further along in the allergic process, as opposed to, when Zyrtec and those kind of drugs were prescription-based, because you would just end up seeing the patient earlier.
But what does that mean?
That's
farther along, are your allergies getting worse through time? Is that it's not just here's they are?
That's exactly right.
And how?
So
how are they getting worse?
And so, so that's a very good question. So, and it's a little bit technical, but in the body, you have these chemicals floating around called interleukins. And interleukins sometimes will play a key role is if you're exposed to an allergen, or let's say we'll just make up something. Let's say you're allergic to oak pollen. And when you're allergic to oak pollen or you have bad allergies, you have these chemicals floating around. And then there's many different numbers of chemicals, but you'll pick the ones important in allergy. And so you have high levels of IL-4, IL-5, and IL-13. Now, when you get exposed to a pollen, in the presence of if there's a lot of IL-4, IL-5, IL-13, you're more likely to make an allergic antibody to it. And so there's studies that have done that shown this. Let's say you take a person who's allergic to oak, and during oak season, you expose them to pecan pollen. And in another chamber, you take someone who's not allergic to oak, and you expose them to pecan pollen. And then 3 months later, you go back and you go and check the blood and see who has an allergic antibody to pecan. And interestingly, the person who was allergic to oak is now allergic to oak and pecan, whereas the one who wasn't allergic to oak isn't, necessarily allergic to pecan. And so allergy tends to beget allergy. And so that's why that cycle just seems to, once it starts, you tend to start going down that pathway. And so that is what I meant, is that when we, now see patients who've been using over-the-counter medicines, they are already then tend to be allergic to multiple different things. Whereas before when those medications were prescription, you would see those patients a lot earlier in the disease process.
Yeah, it's interesting because living where we live and having lived here my entire life with only some brief periods of living away, it's something that we grow accustomed to. My mother had terrible allergies. My brother had pretty bad allergies, and mine are not as bad as my mother's were, but pretty bad. So it's almost something we grow accustomed to. And so watching my wife's recovery or healing or improvement, whatever you want to call it, I almost didn't believe that there was anything that could be done that could possibly make my life so much better. But when I saw it with her, I said, my goodness, that is, especially with this 3 months of just horrible, and it was affecting my ability to do the show. I said, okay, I'm willing to spend the actual time to go and get something done about this. Hold with us for just a moment. Chris Collaco is our guest. That is spelled Collaco. If you want to go see him, it is Advanced Allergy and Asthma Center. It's on Gramercy Street, which is over kind of near Rice University, you could say, a little south of West University, if you know where that is. And otherwise, you can email me, and I will connect you with their website if you want to go make an appointment to see him. More of Dr. Chris Collaco in the middle of pollen season, as we are. Blow your nose, and we'll have more coming up.
The Michael Berry Show.